Is your back so stiff and achy that you aren't golfing? Have you altered your lifestyle because of this pain? Are you not able to sit for longer than 30 minutes without discomfort?
These are common complaints, but it isn't normal. Back pain can be caused by many different events. When it comes to low back pain, many people believe it's either sitting too much, aging, or just being too overweight.
Sitting too much is a common reason. We should not be sitting for more than 5 hours a day, according to a recent 10-year study. Sitting shuts off our own internal stability muscles and allows the core to not be engaged. Over the long run, this leads to a core that doesn't work, your low back becomes weak, destabilized, and you are prone to injuries just from bending over to pick up a pen off the floor.
Sitting also shifts our metabolism, affects our hormones, and leads to early death. We must get up and move, sit less, but how?
Well, the first thing would be to get a stand-up desk, a platform that raises and lowers. Now, you can't jump in 100% right away, but you can slowly adapt your workstation to be able to work up to standing most of the time. Sitting when we're driving and eating also must be factored in.
If you don't have a sitting job, but you have a job where you're mostly standing or walking and lifting, this is great. While it might feel more physically taxing, it's way better than having a sitting job. The caveat here is that you must get conditioned and stay conditioned if you want to prevent an overuse injury.
You must be sure to be working on stability and flexibility for your low back. Please seek out professional advice for this, as there is no one-size-fits-all.
So how do we figure out what's causing the pain? Many patients come in thinking they know the exact source of the pain. Disc, joint, muscles, nerves, tendons, ligaments can all cause pain, and it's critical to properly diagnose the source so that the solution can be determined.
There are many ways to determine which structures are involved in your pain experience, and we do that through a thorough evaluation using orthopedic, neurologic tests, palpation, digital motion x-ray. If needed, other imaging can be ordered to further solidify the sources of pain.
Once a thorough evaluation is complete, we can design solutions for you, including spinal manipulation, instrument adjusting, cold laser therapy, therapeutic rehabilitation through prescribed plan, active cervical traction, curve restoration through orthotic prescription for the spine. While all these treatments can be beneficial, the focus should be on the ones that are most beneficial for your particular condition.
Adjustments, whether manual or instrument, help to create and restore proper motion of the joint, creating less pain from joint structures while also restoring health to the surrounding discs and nerves.
The wobble chair is used specifically to plump up the disc spaces. If you have a disc problem, we'll incorporate this into part of your spinal rehabilitation. It creates motion at the disc spaces themselves. Discs are like sponges. They have very poor blood supply, so the only way they get nutrition and hydration and get rid of waste is through movement.
Think about a kitchen sponge. If a kitchen sponge never gets squished underwater, what happens to it? It starts to shrink and get dried out, crumbly even. This is similar to discs. If you don't actively move each joint space, these discs get dried out, old, and start to deteriorate.
How do you know if you're getting actual joint motion? The only way to know is through a specific digital motion x-ray. We can see which segments are moving and which ones are not moving properly.
Cold laser therapy can be used for the healing of thousands of tissue types, including ligaments, tendons, bones, discs, and muscles. It is commonly used for acute pain from accidents to speed up healing time through activation of certain cells.
Therapeutic, rehabilitative exercises are critical for long-term health and wellness of your back. If you don't want problems to return, it's essential that you do your part. No one wants to hear that, we know, but we can't make the body work any differently.
Properly prescribed stretches customized to you alongside core spinal strengthening will ensure that your results are long-lasting and permanent.
Another treatment we use is the mobilized traction table. This table is specifically used to rehab old dried up discs that have degenerated.
Using this motorized traction provides relief to those who cannot move very well on their own. Of course, this must be done under the supervision with the right frequency and depth of traction.
While many people in their hunt for treatment for their back pain go straight to exercises on YouTube, this might not be where you need to start. There are also some exercise videos that could be making you worse.
Examples of this is that, everyone knows or everyone thinks that crunches and sit-ups are good for core work. While they might activate the abdominal muscles, they're also very irritating to the low back.
And if you have a disc problem, sit-ups and crunches are not advised. So how do you know what's right for you?
There are times and places to do specific rehabilitation of the spine, and this is the knowledge you'll need to get from your chiropractor.
You do not have to live in pain forever. You can get back out on the golf course. You can sleep comfortably again. You can get on your bike again without fear of making it worse. It's actually possible to not sit in agony at your computer and be productive again.
We can help you. Call us or text us today.